High blood pressure is often called the silent killer, but for millions of Americans, the real noise comes from the monthly cost of managing it. Between the daily pills, the quarterly checkups, and the potential need for a cardiologist, the costs add up fast. You don't just need insurance for emergencies, you need a plan that supports your daily maintenance routine. In this video, we are recommending the top 5 private health insurance plans specifically optimized for managing hypertension. We'll look at who has the best pharmacy benefits and chronic care support. Let's get your numbers under control. If your daily routine revolves around picking up prescriptions, your best ally is Aetna. Specifically, the Aetna CVS Health Silver Plan. Since Aetna is owned by CVS, their plans are built around pharmacy integration. For someone taking daily antihypertensives like lisinopril or amlodipine, this is huge. You often get $0 or very low copays for these generic maintenance meds at CVS pharmacies. Plus, you can use minute clinics to check your blood pressure for free or a low cost between doctor visits. Expect an unsubsidized premium of $450 to $650 per month. For those who want a proactive partner to help lower their numbers through lifestyle, look at United Healthcare. We recommend a plan that includes UHC rewards. Managing blood pressure isn't just about pills, it's about movement. UHC has aggressive wellness programs that actually pay you to walk and track your health. You can earn up to $1,000 a year in rewards just for meeting activity goals, which directly helps lower your BP. It's a financial incentive to stay healthy. A Standard Choice Plus plan might cost $500 to $750 per month. But the rewards offset that. If you prefer a system where your doctor, pharmacist, and lab tech all talk to each other, choose Kaiser Permanente. The plan to get is the Gold or Silver HMO. Hypertension management requires tracking data over time. Kaiser's integrated electronic health records are the best in the business. If your blood pressure spikes, your primary doctor knows immediately and can adjust your meds digitally without you always needing to come in. It is efficient and proven to have better heart health outcomes. Full price is typically $480 to $700 per month. For patients who need to see a cardiologist regularly and want specific coaching, there is Cigna. Look for the Cigna Connect plan. Cigna is a leader in chronic condition management. Their Connect plans often come with access to health coaches who specialize in heart health and diet. If you are struggling to get your numbers down and need guidance, this extra layer of support is invaluable. Their networks are tighter, which keeps premiums competitive, often around $420 to $650 per month. Finally, if your condition is complex and you need the absolute best specialists without barriers, go with Blue Cross Blue Shield. Specifically, a Blue Preferred Gold PPO. If your high blood pressure has led to other complications and you need top-tier cardiologists, the Blue Network gives you the widest access. A Gold PPO minimizes your out-of-pocket costs for testing, like echocardiograms, and lets you see specialists without referrals. It is the premium choice, costing roughly $550 to $850 per month, but it offers the highest level of access. Managing blood pressure is a marathon, not a sprint. The best plan for you is the one that makes your daily medication cheap and your doctor visits easy. Before you sign up, check the plan's drug formulary. Tier 1, to make sure your specific blood pressure medication is listed as a generic. If this guide helped you take the pressure off your search, please give it a like and subscribe. Stay healthy.